This is an extract from the Leader podcast by the Evening Standard, hosted by me, David Marsland. To hear the whole thing, search for us on your podcast provider. When it's only July and the sun is shining, most people will think it's too early to consider Christmas. But when you're planning a country's path through winter during a coronavirus pandemic, that symbolic deadline is looming quickly. Will we be able to have Christmas dinner with our families? The Prime Minister was asked today.
It's not only a very important time of year for families, it's also a very important time of year for the UK economy and for many, many millions of people. So it's very important that we hope for the best, but plan for the worst. And clearly the steps that we're taking for September, October, November, they're all conditional on our continued ability to defeat the virus.
That's a lot of caveats, and they weren't the only ones during Boris Johnson's appearance at Downing Street earlier. In laying out the further lifting of COVID-19 restrictions, the PM says everyone can use public transport, but should consider alternatives. Employers can ask people to go back to the office, but they should also think about whether it's still safer for staff to stay home. Events will start again. You'll be able to go to the theatre indoors, but local authorities are getting powers to close them, and ministers can introduce stay-at-home orders. Our editorial column says it's still not clear if the country is opening up or shutting down.
Of course, as the nation eases out of lockdown, the rules will need to change. It makes sense to open up the country as much as possible, while cracking down on the kind of behaviour most likely to spread the virus. But that makes it all the more vital that the government learns to communicate its own rules more effectively. A poll reveals today that 34% of Londoners say clearer government messaging about safety would make a big difference. This is an unknown and terrifying new virus. It is not enough to trust that workers and employers will use their common sense. Frightened people need guidance. Without it, an emergency quickly becomes a crisis.
Our political editor Joe Murphy is with me. And Joe, the Prime Minister seems to be trying to walk a tightrope between opening up and closing down. Can he keep his balance?
It really is a high wire act. And when Patrick Vallance said yesterday, there's no reason to scrap the work from home guidelines, you'd really think, can the Prime Minister really make it to the other side? Today, I thought he gave one of his more assured performances. There was a lot in the statement in his press conference. Very draconian powers in case of local outbreaks. But they were the sort of ballast holding the tightrope down for actually some quite courageous, shall we say, unlocking measures to come. Some unexpected ones. Live theatre to return from August with social distancing, stadium events, some sporting events with spectators. This is and social distancing guidelines relaxed to something near what he called normality from November.
Yeah, I thought that was interesting. It was kind of an optimistic thing he was talking about, wasn't it? He hopes to have the country back to normality around November, maybe even in time for Christmas. And that would be, I guess, a big morale boost for the UK.
There's also a great deal in this scenario for his critics, some of whom are saying this is reckless. They, of course, are in the luxurious position that if it does go wrong, they can call him out and say, you shouldn't have done this. And if it goes well, we'll all have forgotten. There is a lot on his shoulders, and the prize of normality by Christmas, I've got to say, I'll believe it when I see it. Behind the scenes, I'm talking to some ministers and government officials who are actually saying that COVID-19 might be around for a considerably long time to come, certainly as a background disease in this country, one that comes and goes, a bit like malaria in lots of parts of the world, something that you coexist with and learn to manage. And in that context, a lot of what the Prime Minister was saying about going back to work is all about we have to take some of that risk on our shoulders that going back to normal would involve with a virus that's not necessarily going to be magicked away by a vaccine. He's saying go back to work partly because it's not going to end. We don't just get to borrow some money to get through a short-term crisis and then the V-shaped economy comes back and we go back to normal. It could be possible that we are going to be having some disruption to our lives throughout 2021 and maybe 2022, and who knows, in the background at a lower level, perhaps even longer than that.
Something else that has emerged in the last day or two is a controversy over how the COVID-19 death figures are being calculated. And Matt Hancock's ordered an inquiry into this, hasn't he, Joe?
This is one of the most extraordinary things I can remember as a surprise out of the blue. It turns out that Public Health England, who are a public body who have come under a lot of flack during this epidemic for some strange sort of way of following rules, but they have been counting any death where somebody in the past tested positive for COVID-19 as a COVID-19 death. Now, this means, quite literally, that if you had COVID-19 in February and were tested as such, David, and then you were knocked down by me driving a number 19 bus in July, you would go down under Public Health England as a COVID-19 death, because all they're doing is cross-checking the death records with the test records and saying, aha. Now, there's two problems to this. One is, you and I didn't know about it. More extraordinarily still, members of the Cabinet didn't know that was how they were counting deaths. And this came to light because people started saying, why is it that the hospital death rates are coming down, but the community death rates seem to be staying high? And it's because people who had COVID-19 back in March, April, during the first wave, are dying of natural causes. Some of them may well have been accelerated into their graves by the disease, but it not, in common language, necessarily the cause of death. And there's another way this matters. This is because of international comparisons. Believe it or not, and we didn't know this either until today, Scotland have a cut-off of 28 days. If a test was older than 28 days, they don't record it as a COVID death necessarily. And that would get away from the idea of being run over by a bus 5 months later. And we don't yet know what other countries do, but I'm going to make a bet they probably don't do it the way PHE have been doing it.